You ready to get up?
Am I get up now, am I?
Do you want to get up?
I said, I have to.
You don't have to, but would you like to get out of bed?
Yes.
Okay.
Christine Radke is getting her 95-year-old father Herbert ready for the morning. She cares for him around the clock every day.
There isn't a lot that Dad can do for himself, unfortunately. So I have to be constantly aware of what he's doing at any time. Excellent.
No, I'm doing all right.
You're doing magnificently.
Yes.
Herbert has dementia,
Doing all right.
but seeing photos of a recent trip to Japan helps rekindle his memories.
That's the park in the centre of Tokyo.
Yeah. And at lunchtime, remember, all these people came with their little bento boxes.
That's right.
His health is deteriorating, which is making day-to-day life harder.
He had a head bleed, which caused a stroke, which caused the very sudden onset of a type of dementia. So what that means is that obviously there's motor, difficulty with his physical motor abilities, with continence, with memory.
The only help she gets with Herbert is through a government package worth about $16,000 a year when a local carer visits the home. But this year's funding has already run out.
We're surviving at this point on the very, very bare minimum, which is he gets an hour for a shower 3 times a week, and he gets, on the other 2 days, half an hour. 1, 2, 3.
A medical assessment in June found Herbert needs the highest level of nursing care, which would give him another $36,000 in funding. But Christine has no idea when they'll get it.
Straighten up. A lot of days I feel desperate. I have a torn rotator cuff in my shoulder, and it brings its own lot of challenges, and I'm tired.
Herbert is one of almost 100,000 elderly Australians who are stuck on a waiting list. More than half of them need substantial levels of home care. How long they'll be kept waiting is anyone's guess. The Federal Health Department says it will be at least 12 months. But the Productivity Commission recently found it could be double that.
There continues to be an increased demand from senior Australians who want to stay at home. But we have, for the first time over the last 18 months, seen that waiting list come down, and that is due to the additional investment. We'll put an additional 40,000 packages into the home care system this financial year alone.
The problem with home care, it's broken in so many ways. It's broken in the sense that we don't have enough places. It's broken in the very design. It's broken in the fact that that consumers don't have enough information.
Look, we're just ringing up to find out how we're going in terms of the wait list. Dad's on a wait list for level 4 funding.
Despite the Morrison Government funding 39,000 extra packages, Herbert could be waiting most of this year.
Right, so for level 4 we're waiting for...
Yes.
We still have 6 to 9 months.
He's a very positive person, but sometimes he feels that he's a burden.
Well, clearly their situation is extremely difficult, but it's because of these people that we continue to invest.
That's the problem we have looking at us in the face. We have somebody who really needs that care and who inevitably, if it doesn't come, will either suffer at home in a way that he needs to be put into residential care where that's not his preference themselves when they go in.
John McCallum from consumer lobby group National Seniors gave scathing evidence about the state of home care at the Aged Care Royal Commission.
I think the running sore really is the waiting list for home care, and that's really profoundly a critical failure. So the Council assisting the Royal Commission said something in his statement recently that says we should clear the waiting list before the end of the year, and anybody who's assessed should be then provided with the care they're offered in 30 days. So we would strongly support that. That's going to take quite a bit of money.
We will obviously seriously consider all of the recommendations of the Royal Commission, and we will make an initial response and a formal response and a much more major response in the budget.
Stephen Duckett from the Grattan Institute is the author of a recent report which proposes a dramatic shift to providing universal access to care. It won't be cheap, at an additional cost of $7 billion a year.
We need to start off by saying that older people have rights. Just like I have a right to medical care, just like there's no cap on the number of times I can visit a doctor or a specialist or whatever. So first of all, you have a right, and then you have access to the care, and you also have a broker that helps you manage this.
Minister, how many residents have COVID-19 today?
Again, Senator, I don't have the report.
730 has been seeking an interview with Richard Colbeck for months over his handling of the aged care portfolio during the pandemic. 685 aged care residents with COVID-19 have died. More than 2,000 have been infected. In December, a ministerial reshuffle resulted in Greg Hunt taking over aged care, with Richard Colbeck moved to aged care services. As Minister, how did you underestimate what oversight was required by you to ensure the sector was ready for the pandemic?
Well, I don't accept that the government did underestimate the oversight at all. We started working with the sector with respect to what they might be required to do in January of last year. We started providing them advice very early with respect to what we knew at that point in time about the virus. And as we learnt more, we provided them with more advice, and importantly, we provided them with additional resources.
The Aged Care Royal Commission special report found that all too often providers, workers, the elderly and their families couldn't answer the critical question, who is in charge? Do you want to apologise to families whose loved ones later died for that leadership vacuum?
Well, the issue of leadership within an aged care facility is one that has been exposed by the pandemic, and we've seen that on a number of occasions. And that's one of the reasons that the Aged Care Quality and Safety Commission has acted on a number of occasions to issue a notice to agree to provide additional leadership capacity within facilities.
So do you want to apologise to those families?
Every single death that occurred within aged care in this country has been an absolute tragedy, and my condolences I will repeat now, as I've done on many occasions, to every single family who have lost a loved one. As
the minister at the time, doesn't the buck stop with you for that leadership vacuum?
Under the Aged Care Act, which the Commonwealth administers, all providers are responsible for having appropriate leadership within their facilities. It is our job to ensure that that's the case.
But the federal government funds and regulates the sector, and you had a regulator, the Quality and Safety Commission, who was only visiting a very small number of aged care facilities with COVID outbreaks, something like just 30 of the 220 nursing homes at the time. I mean, isn't that an unacceptable number? You weren't on the ground in those aged care facilities finding out what was going wrong.
Look, I think that's an extremely unfair characterisation of the circumstances at the time. The Aged Care Quality and Safety Commission were acting on health advice with respect to entry into aged care facilities.
I'm very proud of you.
Christine Radke is trying to cherish the time she has left with her father, but looking after him is challenging. She's speaking out because she believes he and others deserve better.
I take risks all the time, and the risks are part of the stress. If I have to go to the chemist to pick up something, I have to leave Dad alone. And I'm very aware that if he was in a care situation, they would not consider him safe to be left alone. He isn't safe to be left alone. If we had the level 4 funding, I would be able to have people here. Some grapes as well.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.